Before we continue, I'm going to ask somebody from the community to please open for us with a prayer. Is there any volunteer? Ek is geskok mense as ons hier wil bid nie. Any volunteer? Niemand nie. From the staff? Niemand nie. All right, let's stand up. I will open for us with a prayer. Please take your hats on the heads. Let's bow our heads and close our eyes. Thank you, wonderful Lord, for this beautiful day that you have blessed us. Thank you for the lovely sunshine, also that we're having a bit of cooler weather. Thank you for bringing all of us safely here this morning. We pray that God will bless these proceedings, bless each and every one of us, and take all of us back home safely. We pray this in Jesus' name. Amen. En bly net staande asseblief. Bly net staande. Ons gaan lekker volle bord ons volkslied. Thank you.
Posisileleli Afrika, malupa Yesu pondorayo, Israeli tanazo yetu, posisileleli China, usapolwayo, Ulela uluka sichama sa Yesu.
Now before we continue, we're going to have some introduction from the members. I apologize, we're not many in the front here today. Normally we are many more, but we've had a lot of apologies from the members. And then secondly, I will then also introduce the staff and the teams from Parliament, and then I will ask the Executive Mayor, Mr. Trevor Abrams, to just give a message of welcome. Ek het almal dit verstaan, en seker dit nou te translate nou nie. So, ek gaan net begin aan my linkerkant, dan begin ek met al die lede wat in loos sit om myself voor te stel, en dan sal ons die prosesse verder doen. Dankie.
Goeiemôre, good morning, Dumelang. My name is Michelle Clark. I am a member of the Health Committee and also a member of Parliament. And we look forward to your deliberations today on the tobacco bill. And thank you for coming. Thank you.
Good morning. My name is Stumo Dlamini. That's the surname. And I really appreciate that we are here for this important debate. And I am a member of the Portfolio Committee for Health, but also a member of Parliament. Thank you, Chair.
Good morning, goeiemorgen. My name is Nhlanhla Xaba. I'm the Member of Parliament, also the Member of Portfolio Committee of Health. We look forward to your inputs on this important bill. Thank you.
Good morning, everyone. Dumela. My name is Dr. Xiaomei Harvard, member of the National Assembly and a member of Portfolio Committee Health. Nice to meet everyone. Try to learn more from you at this special event. Thank you.
Good morning, everybody. As the chairperson has mentioned, I'm Trevor Abrams. I'm the executive mayor of Witzenberg municipality.
Thank you very much, everyone. So just our officials, we have our committee secretary, Ms. Majalamba, and supported by Ms. Tia next to her, Ms. Mane, Mr. Rahim, Mr. Mave, those are two of our researchers. And then we have outside Ms. Makubane, Mr. Bedi. And then we have from the Minister's office, we have Mr. Joe Khatla. And we have from the National Department of Health, led by Dr. Lynn Muheng Mashambu. She's somewhere here, thank you. And a technical team with Ms. Loratu Mahura, Ms. Zikona Mpiana, Mr. Sen Echekhan, Mr. Tsepo, difficult one, Mansao, and Ms. Helen Mosia Shab. Thank you. I'm sure I didn't do too badly with the pronunciations, maar baie dankie aan julle almal dat julle gekom het en natuurlik is ons geondersteun deur ons publieke opvoedingsgroep, our public education, our communication services, which I will mention just now again, our protection services, and we am I missing out? And yes, I think I've got all of them. And then we also have our language services, as I had mentioned, so you are free, and they right in front here, and they will be doing any translations which need to be done, and then we have our crowd sign language, official sign language in South Africa. Thank you very much for your translations here today. And before we continue, I just want to hand to the Executive Mayor this opportunity to do a message of welcome to us. Thank you very much. Let's give him a round of applause.
Thank you, Chairperson. Good morning, everybody from my side. On behalf of Witzenberg, the entire Witzenberg, the entire inhabitants of Witzenberg, I would like to welcome each and everyone who's present here today. But also on behalf of Witzenberg municipality and all the councillors, a great word of welcome to each and everyone. You know, as you enter Ceres, most of the people will say, wow, what a beautiful entrance. But that is part of our welcome. It's clean, it's tied up. It's definitely something to ponder and to remember. But also the inhabitants of Witzenberg, and especially in Ceres, the valley of fertility. Smiles, happiness, friendliness is in abundance. And I hope that you've experienced that as part of the welcome. Specifically, members of the Witzenberg community and other stakeholders present here this morning to come and make your inputs, to be the voice of Witzenberg on this important bill. Welcome to you. Then to the councillors present, Chairperson, they've grown to 12. If I include myself, then we have 30. Welcome, colleagues. It's important that we take the lead on behalf of our communities and make sure that they get the message to be present. So welcome to you also. Chairperson, you've mentioned the supporting staff. I would like to welcome all of them. The members of Parliament, you've mentioned that from the Minister's office, there are representatives from the Minister's office, and all the supporting staff that you've mentioned. Luckily, you saved me all the tongue twisters with the surnames, but a heartfelt welcome to them also. And then Dr. Jacobs, yourself, and the members of Parliament sitting in front here, McClark, and I'm going to say Shalom, because I can't pronounce your surname, Mr. Dlamini and Mr. Clark. A special word of welcome to you, because you have to do the oversight of the whole process that's going to happen here. So we extend a very, very hearty welcome to you and all the best for today. With that, Chairperson, again, welcome to everyone.
Thank you, Mr. Grims. Now let's just talk a little bit on the bill so that we have an understanding what we are here for. We heard Mr. Abrams say that we have oversight over this process. So when a bill is sent, when there's an intention to make a new law, there is this document that is written called a bill, and that bill is then sent to Parliament. It would normally be a member of the executive, meaning a minister, but it can also be a member of Parliament, which would then be called a private member's bill. And that bill then goes to through a tagging mechanism at Parliament, and it is then forwarded to a portfolio committee, which is thought to be the committee to deal with that particular bill. So wanneer daar idees om 'n nuwe wet te bring of 'n verandering aan 'n wet of 'n wysiging aan 'n wet, dan word daar 'n konsepwetgewing geskryf, dit word deur die minister ingedien of deur een van die lede van die parlement, dan word dit 'n lede konsepwetgewing en dan word dit verwys na een van die komitees toe, en die komitee wat die werkgroep sou dink is die komitee wat dit bedien, en dit is nou in ons hande soos ons nou hier sit. Ons is gewoonlik 11, ons is vandag 5, maar dit is iets wat ek nou weer self sal opneem. So, to tell you about the bill, it was introduced into Parliament by the Minister of Health on the 31st of May 2023, and when that bill comes to Parliament, then we are obliged, according to the Constitution, that's Section 59(1) of the Constitution, that requires National Assembly and its committees to facilitate public participation in this legislative and other processes. So wanneer dit is ingedien deur die Minister van Gesondheid 31 Mei 2023, en ons word volgens seksie 59(1) van die grondwet word ons verplig om hierdie publieke verhore te hê en julle geleentheid te bied om julle inslae te kan lewer. So what do we want to achieve? This portfolio committee, the idea is to increase access by having you all here today. Ek is baie teleurgesteld dat hierdie saal so leeg is. Ek moet sê, as ek al die klomp wat saam met ons rondreis wegneem, en as ek die raadslede wegneem en die departement wegneem, dan sê ek maar amper niemand van Ceres hier teenwoordig en al ons staf ook wegneem. So ek wil dit baie duidelik stel dat ek baie teleurgesteld is en dat ek hoop dat by Sondag in Pero ons baie meer mense teenwoordig gaan hê as wat ons vandag hier het. So how do we do this? We do this through information sharing, through education, consultation, involving the public in the processing of this bill, which is called the Tobacco Products and Electronic Delivery Systems Control Bill. And this visit to the province of the Western Cape is our 7th leg. This is our 7th province. We will complete this province on Sunday, and then we have only the provinces of KwaZulu-Natal and Northern Cape left. Wat is dit wat hierdie konsep wetgewing wil doen? Is dit wil die vorige wet wat genaamd is die Tobacco Products Control Act of number 83 of 1983, and its 3 amendments, and its 3 amendments of 1999, 2007 and 2008. It was a repeal wet, omdat dit wil teruggetrek word. En dan word hierdie konsepwetgewing, wanneer dit deur die proses gegaan het van die nasionale vergadering, die nasionale raad van provinsies, en dan as dit goedgekeur word, gaan dit dan die president om af te teken. Ons het nou net deur die proses van die nasionale versekeringswetgewing gegaan, the NHI, and you heard the president speak about it, so just bring you into context. And he said he's purely looking for a pen to sign it off. I was going to offer the president this pen. He's unfortunately not here now, but I could offer him this pen. Maar nou kan jy verstaan hoe ons nou deur het gegaan in die afgelope 4 jaar, en dit is dieselfde proses wat ons nou hier volg. Gelukkig vir ons is daar nie 'n COVID-periode nie, so dit gaan baie vinniger gaan. So it is to bring the tobacco legislation in line with the current developments internationally, regulating smoking, packaging, sale and advertising of tobacco products and electronic delivery systems. En vir die mense wat aankom, vir ons kom sê dat ons kyk om tabak te verban, en wanneer hulle nou weer sê, moet dit nou nie weer kom sê nie, né? Julle was nou 'n hele paar keer ingelig dat dit nie so is nie. Luister mooi. Dit gaan oor regulasies. Regulate smoking, packaging, sale and advertising of tobacco products and electronic delivery systems. So dis die rook, dis die verpakking, dis die verkope en dit is die advertering daarvan, en ook om te verseker dat mense nie in areas rook waar ander mense beïnvloed gaan word, negatief beïnvloed gaan word as gevolg van 'n ander persoon se rookgewoontes nie. So dit sou wees in toespasies, of dit by werk is, of dit is in 'n area waar daar 'n klomp woonstelle is, of dit is waar daar 'n kind teenwoordig is, of 'n nie-roker teenwoordig is, of beide in 'n private woning, of 'n multi-unit residence, dit gaan dieselfde ding wees. So the whole idea is to protect the vulnerable people from the effects of smoking, second-hand smoking, other smoking, inhalation, and all the problems which are associated with it. And then on the advertising or promotion, it's to prohibit it, and also will that the minister will prescribe the packaging and the labeling of tobacco products, including health warnings, and to bring about restrictions of sales of tobacco products, which means it will not be allowed to be sold to children, not in health establishments, and that there will be no distribution through courier services, postal services, of hierdie verkope oor die internet. The minister will appoint a monitoring committee that will monitor the implementation of tobacco control programs, laws and enforcement, en dan ook wil hierdie wet, in ander woorde as 'n opsomming, wil 'n wettige raamwerk daar plaas sodat mense wat vulnerable nou weerlose mense, goeie Afrikaanse, sodat weerlose mense beskerm kan word deur die wetgewing, and it's to provide a legal framework to protect vulnerable people such as children, pregnant women, non-smokers, including those who don't smoke e-cigarettes, and employees from the effects of smoke of others. Nou, ons wil graag hê, gaan nou verduidelik hoe dit gaan uitspeel hier vandag. Elkeen gaan 5 minute kry om te praat. Ek dink dit gaan 'n bietjie gouer gaan, want ons gaan weer vra, so hulle kan 'n indikasie gee as iemand in die Xhosa wil praat of in Afrikaans of Engels, en dan kan ons kyk hoe die translations gaan plaasvind. Dit sou die translations insluit. Ons het min mense hier, maar ons begin met die plaaslike mense. We start with the local people. And there's a lot of lobbying throughout the country by particular groups who have interest, up to the point where we were not comfortable in particular provinces, because the lobbying was so active that we felt that we were being threatened. Our safety was being threatened. And I want to make it clear again that I don't expect that to happen here today or in the future again. So, local people, net om vir julle te sê, julle het geleentheid om skriftelike voorstelle in te dien. On my right-hand side, we have a table of our staff, very capable staff, very good staff, who will take your written submissions. So your written submissions would be, when you think you've not had enough time allocated and you wanted to say more, you're welcome to add in a written submissions. It had closed on the 4th of September of 2023, but we deemed it important to open it again only during the public hearings. Remember, it will now not be open, the one that had closed. It's for this period where we go, for you to be able to hand in a written submission. So try and do that. And then please don't approach our stage. Please don't jump onto the stage. I keep saying this now. Where's my culprit? I keep saying this now. There's the culprit. We are not to be approached. And then secondly, please, this is not a contestation. This is us listening to all of you. We are here to listen. We're not here to get into a dialogue with you. We're not here to give you any opinion. And we're not here to answer any questions. We will get to that process, which is our own process. After this, there are other processes, and we will do that in our own time. To take it further, you see there are chairs in the middle, 10 chairs. The process normally is, I will say to the people on my left, please raise your hands, those who want to give a verbal input, and then take your chairs as I indicate to you who should take the chairs. I'm going to ask again the people, local people, first. And then after that, when they had completed, I go to the people on the right, and we do the same thing, and then we go back to the left, and so we continue until we've exhausted the process. So, I think that's where we are right now. As daar enige iemand wat nie verstaan het wat ek gesê het, is there anyone who wanted anything to be said in isiXhosa? I know the Western Cape well. I live around the corner. I know the languages which we speak. Dit is gemakkelijk. I will take hands on my left-hand side. Anybody who wants to give input, please raise your hand. Steek jou hand op asseblief. Ian, come forward. Please take the first chair. You will see we have our protection services who will guide the process on the floor. Is daar enigiemand anders aan die linkerkant? Anybody on the left-hand side? And as I said, feel free to speak the language which you are most comfortable with. Twee, kom vorentoe asseblief. Neem 'n sitplek in. Anyone else? On my right-hand side, the back, come forward. Anyone else on my right-hand side? Number 4, young lady. Number 5. Anyone else? Anyone else on the right? Kan ek 'n bietjie stilte kry asseblief? Kan ek 'n bietjie stilte kry asseblief? Daar's 'n sitplekke wil inneem, neem dit asseblief. Anyone who wants to occupy a chair, you're welcome. François, jy kan maar. Ek ken jou nou al so goed. All right, we'll stop there and then we'll see on the next round. You can step forward. Now what you do is you step forward to the microphone. When that one vacates the seat or the chair, then the others move forward. The lady behind you can move forward and you all move forward. And then please you state your name. And then you also state whether you support the bill or you don't support the bill. And then you give your input. Thank you very much.
Goeiemôre. Diabolisa $1. My name is Dennis Mengani from Cape Town. But I will see that Mr. Chiwelu, from the left hand side, nobody was lifting any hand. That's why I decided that let me stand up now. I do support the bill. Because it affects the lungs. I'm almost 60 now here. If anybody here was maybe 40 years of age, if you had maybe an x-ray or a scan, you scan my lungs, and the person who's been smoking for 20 years, surely there's a big difference there. So that means the tobacco is something that is really affecting our lungs. Number two, it's also affecting even the production in our service delivery. Maybe Mr. Mayor will say yes. I mean, if people now are working for 8 hours, 1 hour is been spent of smoking, breaks, you know. And here we are now. They are we've got a lot of family members who died of cancer caused by smoking. So I do support the bill 100%. But I've lost an uncle because of that. My uncle he was so diabetic and he was smoking, and the doctors told us that the tobacco, it affects the flow of the veins here. That's why you end up being because the oxygen couldn't get there. So millions yabola afike inqunyuliwe. Ngayandoni ye tobacco. So I do support the bill 100%.
Can I just do a quick test? So we had now a mixture of 3 languages. Is there anyone who needed a translation? Kan ons so aangaan? Ons het nie regtig dit nodig hier, né? Dankie.
Sorry. Ek het 'n bietjie sinus, né? Goeiemiddag, ek is Afrikaans. Ek is Sofia Thomas, ek is van die Witzenbergstreek. Ek woon in Woesley. Oor die jare het boere plantasies gehad van tabak. En ek sê nie dat ek die bal nie gaan ondersteun nie, maar volgens my is dit verkeerd. Want ons moet dink aan die boere wat tabak plant. Ons weet dat dit 'n gesondheidsrisiko is, reg. Maar waar dit gerook moet word, dit is nou ongelukkig nie ons besluit wat ons maak nie. Want kinders tot 9 jaar oud, hulle rook sigarette, hulle rook tabak. Maar my groot concern is dat ek nie die bil ondersteun nie. Want ek dink aan ons plaasboere wat ook werkers ondersteun deur werk vir hulle te gee, deur plantasies te plant, want tabak, sigarette word van die plant gemaak. So, ons as ons dink aan om die bil te ondersteun, dink ook aan ons boere wat plantasies het, asseblief.
Good afternoon. Good afternoon, Chair, members of Parliament, Portfolio Committee. My name is Sophia Thomas and I live in Wolseley. I'm from the Witzenberg district. I just want to say that I do not support the bill and I do not contest the fact that smoking is bad for you. I know it's bad for you. But we must also think of the farmers who have plantations and who farm tobacco. They create jobs and they create their income through the farming of tobacco products. It's not our decision to decide who should smoke and who should not smoke. Although it is a health risk, and I acknowledge that it's a health risk, I also know that children as young as 9 years old smoke. And I can never say that's a good thing. It is bad. But for the sake of the farmers who create an income and who also have a livelihood farming tobacco products, I plead against this bill. Thank you very much.
Good morning, everyone. My name is Asamachen Namboyi. I'm a community member of the ANC based in Duli and a part of the cancer organization. I fully support the Tobacco Products and Electronic Delivery System Control Bill. As a full member of the community, we face different kinds of challenges in our workplaces and in homes. The tobacco, it doesn't only affect our health, but it's affecting our siblings, and in homes, our parents are getting nerves about us that we smoke. And to the lady that says she doesn't support the bill because of the farmers, yes, that is good, but the farmers too are humans, and humans oh, sorry. And njengoba thina singabantwana siyazi irongo into yoba sichaye itobacco kwi-community yethu, and loo nto leyo iyasicinezela kwi-health yethu, isicinezela kwiinto zesikolo, and iingqondo zethu ziyafela in some point in smoking. So, in ukuzama to iyeke ilento, andithi ba iyeke, but ukuzama uhlehlisa ilento oh.
To add on what I've already said, the smoking issue also affects us as children, because it affects our health as well as the functioning of our brains when it comes to school.
Malibongwe. Gama lamakhosikazi. I'm here dilapha ukusupporta ubudlobongela ngenxa yokuxinana kwezindlu nokuchaya. When is not a space ukuba kuvuleke umuntu kube khona into eyenzekalayo ebantwaneni. Because when you smoke umntana uyabona uyasmoka nawe uyasmoka. So apha thina eVassenberg no one can help for us. Ngaphandle koThixo sicela yonke imihla sisuke emasakeni sinezindlu eziningi umntana wenza lonke into ayenzayo sicela please ispace sizobona into abantwana na singakwazi babona na sibaqeqeshe ukuthi no is no. Now thina sihlala nabo because there's no space asifumani izindlu zithatha abantu basemaplasini zange even 1962 sibe better life for housing. So sicela ugovernment yoba aqala ayokwenza i-research pha ukuze abantwana bangazikwazi ukungenelela ukwenza ubudlobongela kungenxa kantoni because thina sihlala ugovernment okwazi ukusinceda ngoba sisendaweni even le-council azikwazi ukungenelela ngoba thina sisendaweni encinci. Loo nto eyenzekalayo ukuthi noma singakhala zithi yasebenza akwazi, there's no field, akho library, akho nix eklaleni. Besicela ukuba nina abantu bakagovernment ukuze kuphele lento khani ke niye niyokwenza i-research ndibona uba nizayenza kanjani le nto leyo. Ngiyabonga.
Chair, I support the bill because this issue of drugs such as tobacco creates overcrowding in our spaces. We often find ourselves asking for help from God because that's where we get our help. The most important thing we're asking for is for the space so that we can have an opportunity to discipline our children so to a point where they avoid being involved in drugs. We do not have houses, and that's one of the things that contributes in the inability of our children to avoid being involved in violence as well as in crime. So we ask that you actually come and see for yourselves and conduct some research so that you can see how you can assist us in this regard.
Hi there, good day. I do not support the bill, more specifically the vape product side of it. And in the short time allocated, I'll try to convey why that is, that I feel there needs to be a clear differentiation between traditional tobacco products and alternative vaping products. Firstly, the violation of personal liberty. The bill encroaches upon the fundamental right of individuals to make informed choices about their health and lifestyle. Adults should have the autonomy to choose less harmful alternatives to traditional smoking tobacco products if they wish, without undue government intervention. We believe adult smokers and vapers should be encouraged to quit smoking with the help of vaping products. And in countries like New Zealand and the UK, their governments are already doing this with great deal of success. Secondly, stifling harm reduction efforts. This is quite an important point that I want to drive home and hope everyone understands very clearly. Electronic cigarettes, when compared to traditional cigarettes, have been shown in numerous scientific studies to be a less harmful alternative compared to tobacco cigarettes. Heavily regulating them impedes harm reduction efforts, preventing smokers from accessing potentially life-saving alternatives. We support the regulation of these products, but the regulations need to be proportionate to the harm caused, and that's the important part of it. Tobacco and vape products can simply not be regulated together with one-size-fits-all regulations. Thirdly, economic impact. The e-cigarette industry supports numerous jobs and contributes to the economy through taxes and sales revenue. Heavily restricting e-cigarettes would not only eliminate these jobs, but also result in lost tax revenue for government. The taxation of vape products have already seen numerous vape businesses close down, resulting in numerous job losses. Number 4, unintended consequences. Prohibition or heavy regulation often leads to unintended consequences such as the proliferation of black markets. If e-cigarettes are heavily restricted, it's likely that a black market will emerge, leading to unsafe products and increased criminal activity. We have already seen this happen during the COVID pandemic under lockdown. Lack of evidence-based policy in the 5th place. The proposed bill may be based on unfounded fears of misconceptions rather than empirical evidence. Decisions about public health policy should be rooted in scientific research and data only, rather than knee-jerk reactions or moral panic about underage children, which we believe should not be part of the whole vaping market anyways. Most of the scientific research today confirms that vaping only carries a fraction of the health risk when compared to combustible tobacco. Recognized and well-respected medical and research bodies all over the world has already confirmed this. Number 6, disproportionate impact on vulnerable communities. Heavily regulating e-cigarettes could disproportionately affect marginalized communities who may rely on e-cigarettes as a tool for smoking cessation or harm reduction. These communities often face higher rates of smoking-related illnesses and may result the most from access to these safer alternatives. Lastly, missed opportunity for regulation. Instead of over-regulating, we support regulations to ensure the safety and quality of e-cigarette products, restrict marketing and sales to minors, and that we feel as an industry quite strong about, and promote responsible adult usage. Such measures would address public health concerns without depriving adults, again adults, of a potentially valuable harm reduction tool. In conclusion, the proposed electronic cigarette bill in South Africa represents an overly restrictive approach that undermines personal freedoms, public health, and economic well-being. Policymakers should reconsider and opt for evidence-based regulations that balance harm reduction efforts with legitimate public health concerns. So I appeal to you not to use this exercise as just a box-ticking exercise. Numerous jobs are on the line, and you can save millions, if not billions, of lives. I thank you.
Can I just ask that you introduce yourselves? Pardon? And I asked to indicate whether you're supportable. Is that what you? Yes, the lady before. So, where's the man who just spoke? You can just tell us what's your name? Oh. Okay, and the lady before, where is she? Come forward. Come forward.
Okay, mna ndimbekethetha apha malunga nokucinezeleka with no space for abantwana ukuba bangawuvala moya yokuba kuyatshaywa intontombi. Nguboniswa ntanjana ocela into yokuba ibonelele induli ngespace nezindlu. Enkosi.
Thank you. All right, so when you speak, also introduce yourself and say whether you support or not supportable.
Molweni hlanga phambili ndiyabulela elithuba ndawuthetha isiXhosa Igama lam nguMiriam Sifile, ndingumhlali waseNduli, eWitzenberg. Ndiyayixhasa le bill. Isizathu bandiyayifastana kakuhle, ayibhenishwa mos le act. Qha kufakwa imiqathango. Ngoba ngenxa yokungabikho kwemiqathango, thina abantu abangatshayiyo singabona bona ba-affected. Umzekelo, ngenxa yesigarethi, ulutsha lwethu luyanqanqatheka. They are heavily addicted. As the result, baye kwi-drugs. Ekutshayeni kwabo i-drugs baphokozelela ezikolweni. Ndithetha nje, isikolo sethu i-primary seyine-gangsterism ngenxa yokutshaya oku-over kwade kwayiwa kwi-drugs. And enye into, iikliniki zethu zigcwala unnecessarily ngenxa yabantu abatshayayo bade bagule, babe ne-TB, babe ne-cancer ngenxa yokutshaya. Mna ndiyayisapota le bill ngoba ngantoni abona abantu abasokolayo ngabantu abaninzi abahluphekayo. Sophuma njani ekuhluphekeni xa sizawuphinda sizifakele ngokutshaya oku-over kuba kwenziwa nje ngoku, and awukwazi nokunqanda because awukwazi nokuya emapoliseni ngoba lokhu akho nto imthintelayo umntu uba angatshayi esidlangalaleni. Mna ndihlala ngaserhangini ndiphefumla esaa smoke sesigarethi. Enkosi.
Chair, my name is Miriam Sivile and I'm from Nduli, Witzenberg. Firstly, I want to highlight that, I want to note that I support the bill because if I understand it well, this bill does not ban smoking, but simply brings about limits. And the reason I support this bill, it is because smoking affects more non-smokers than it does the actual people who smoke. And also it encourages addiction among the youth. And this addiction of smoking cigarettes leads to drug use. And that in turn leads to other things such as gangsterism. For instance, now we find that in the primary school from where I come, there is gangsterism found happening there. And secondly, our clinics find themselves overflowing with patients who are smokers. And finally, smoking affects particularly the poor, which makes me then wonder, how are we then going to get out of poverty if we're going to find ourselves in such things that encourage poverty, such as smoking?
Is it afternoon? Oh, good day, everyone. My name is Nokubonga Linda Nonkai from South African Tobacco Free Youth Forum. I am one of the amongst victims of tobacco and its related products, such as hubbly bubbly, hookah pipes, etc., which caused by passive smoking due to unregulated and substance abuse. Secondhand smoking contains more than 7,000 of chemicals. Hundreds of those chemicals are toxic, and about 70 can cause cancer. I have lost so many opportunities in my life due to health-related matters. Then I tend to think of how many people or the youth who are also experiencing the same problem as I.
So that is why today I am here to support the bill to be passed so that we can have a healthy free youth generation. Thank you.
Okay. Molweni ndizawuqale ndibulele elithuba endithenda lifumana apha namhlanje. Igama lam ndingubabalo, ifani nguyisa, ndingumhlali walapha eNduli kwiWitzenberg local municipality. Nam ndiyayisapota ibill, ndihambisana nayo kakuhle. Itobacco ingozi kakhulu itobacco. La kweza enki zithengiswayo pha ibhaliwe itobacco, ithi tobacco, ithi smoking tobacco causes cancer. Iyacacisa laa nto ithi kuba utshaya itobacco uzaba ne-cancer, meaning kuba izaba nento yenzayo apha empilweni yakho, ikhona izinto ezazilimaza ngaphakathi. Umzekelo i-enki, banintsi abantu ababulalwe yi-enki, abanye babulelwe yi-enki bengayitshayi i-enki. Ngokuqhuma nje kwesmoke sayo i-enki nomnye umntu ocangwa kuyam-afektha laa nto. So ithi loo nto iyingozi kakhulu i-enki. Umzekelo i-hookah pipe ithi iphule i-1, it's like utsale i-100 yee-cigarettes. So imagine umntu otshaya i-100 yee-cigarettes uba njani. And siyababona abantwana bayaphela elokishini. Abantwana abancinci batshaya i-enki, bathengiselwa ngabantu esingabaziyo. Umthetho lo kuthethwa ngawo asiwuboni umthetho ungenelela ukunqanda abantwana abathenga i-enki. Tshaya ngabantwana abancinci i-enki, basiqhumisela nge-enki. Esikolweni bayigqithe kwi-enki, batshaya ii-drugs. Ezibaye betshilo umama. Into yoba ii-businesses ziyathengisa zenza imali kunabantu abatyayo ngesigarethi, loo nto ayisingeni ndawo kuloo nto thina. Qha into esiyijongayo yimpilo thina. Bona bayayifumana imali, bayayithengisa loo nto bayithengisayo, kodwa impilo yabantwana isengcuphekweni kakhulu. So mna ndiyayisapota ibhili, ndithi itobacco mayipheliswe itobacco. Nathi itobacco siyayisebenzisa singabantu abamnyama. Umzekelo iboksari, xa senza imicimbi phaa fike kuqhunyiswe phaa kubekho iboksari nezineyifu phaa. Kodwa loo nto xa ndiyijonga mna kudala ngokwesintu itobacco yayingekho itobacco. Abantu abakudala babengayitshayi itobacco, babetshaya iweed, laa nto kuthiwa yintsango, baqhumisa intsango, baqhumise yona intsango. Itobacco ifika ngoku. And indlela enziwa ngayo itobacco ine-chemicals ezininzi itobacco. Inamatayere phaa afakiweyo, inepetroli, inintsi nje into ebulalayo phaa itobacco. Inintsi into nayithetha ngetobacco, irongo itobacco kakhulu. Irongo kakhulu itobacco. Izinto zitshintshile ngenxa yetobacco. Kunomnye umntu owaswelekayo apha eNdula, nombiza ngegama. Waswelekelwa ngenxa yesikefu. Wawuhlatywa ngemesi ngenxa yesikefu. Yesikefu uba hayi ndicela isikefu. Usazela apha isikefu wena. Yaphela kubulawana ngenxa yesikefu. Zizinto nje ezincinci nje ezi. Hayi ndiyehla ndiyabulela.
Greetings to you, Chairperson.
Just give me a minute quickly. I said before, this is not a contestation. I don't appreciate you whistling in our meeting, and I don't appreciate you clapping so much hands. And you don't have to clap them twice when somebody says that. So my job is to keep order in this meeting. You would see that it's being recorded. I would expect you to behave. Thank you. Please proceed with the translation.
Greetings to you, Chairperson, and everyone here today. Firstly, I would like to say thank you to the opportunity provided for me today to have a view on the bill before us. My name is Baba Loisa. I'm a resident of Unduli here in the Witzenberg municipality. I want to state that I support the bill. The reasons for supporting the bill is that fundamentally, tobacco is a very dangerous substance. This is very evident because even on the cigarette packets, it is clearly written there that smoking causes cancer. Obviously, this means that your health is going to deteriorate in a very rapid pace. Many people die from cigarette smoke, particularly secondhand smoke. It is very dangerous. I've once read and done some research and found that the hookah pipe that people smoke is actually equivalent, one pull of that hookah pipe is equivalent to 100 cigarettes. So if you can just imagine the impact on that person's health status if a person is going to smoke 100 cigarettes in one pull. The smoking is particularly damaging to small children. As a result, the children end up going from the cigarette smoking to taking drugs. I want to state that even though businesses are here and have an interest in making profit from cigarettes, which are evidently dangerous, I want to add that as community members and as people of South Africa, we are not concerned about profit making. Our concern is our health that is deteriorating as a result of cigarettes. Our lives are basically at stake, and I want to categorically state that tobacco must cease to exist in our society. To end off, I want to make an example that in our own African culture, we have had in the past elders of our communities smoking, but they rather smoked marijuana because it is a herb and it is natural. So I find that this was actually healthier than tobacco, which has many dangerous chemicals. In tobacco, you can find tires and other dangerous substances that are made to mix this tobacco product that becomes a cigarette. I've also experienced in my community the violence that ensues from the smoking of cigarettes because people stab each other for failing to share cigarette smokes with each other. As I close off, I want to categorically state that I support this bill and tobacco must cease to exist in our society. Thank you.
Mr. Chairman, as you rightly said, Francois, and as you also know by now that I reject the bill in its entirety. Voorsitter, ek wil vir jou baie dankie sê dat jy vir my 'n geleentheid gee. Dankie dat jy my laat welkom voel het en dankie dat jy my met respek hanteer en I intend to do the same. As you know, from the beginning and the very first hearings in Rustenburg in the Northwest, I tried to assist the committee because of my vast knowledge across the whole tobacco environment, including the regulatory environment, both here and in the region and internationally. Chair, it amazes me that we still hear people here who say, well, ban tobacco, tobacco must go, a new bill is the golden thing to solve the tobacco problems. Chair, there's much, much more to tobacco control than meets the eye or just a new bill. Chair, and my fight is not with the committee. I've said that from the beginning, and because of the various hats that I wear, in an informed position to make properly informed choices. You have also seen across the provinces so far that there's very little support for the bill other than NGOs with scripted pieces of paper just saying the rhetoric of the past 30 years. There's much more to that, Chair. My problem, Chair, from the beginning was that in rugby terms, this department gave you as a committee a hospital pass. Daai hospitaal pass wat jy's dood as jy hom kry, and that's almost where you are. And my guidance and my respectful input right at the beginning was that the committee and Parliament should say to the department, you have not done your homework, go back and come present a properly developed bill to us. And I repeat, Chairman, the requirements of compiling a bill has not been met, and it is going to cause problems going forward. It is a requirement to do a socio-economic impact assessment, a fresh one. It is a requirement to consult widely. It is a requirement to do a cost-benefit analysis. None of that has been done. Chair, and the departments, in writing, they say this is not about banning tobacco. You repeated it this morning, it's not about banning tobacco. But respectfully, Chair, to you and the committee, just look at the numbers of times the word ban comes verskyn in hierdie wet. It is a total ban on the display of tobacco products. 100% ban. It is a total ban on the sale of single cigarettes. How many people from communities have stood before you, Chair, and saying, that is how we feed our families? It's a total ban. It is a total ban on indoor smoking and a severely restricted ban outdoors. That's just short of a total prohibition. Plain packaging is a total ban on the use of trademarks belonging to brand owners by replacing it with plain packaging. Lumping traditional tobacco products and new generation products into the same bill is a ban on a golden opportunity to bring harm reduction into the tobacco debate. You've heard how many scientists explaining to you the need for harm reduction and how it can be incorporated. So, Chair, with all the respect in the world, this bill stops just short of a ban. It is a cut and paste job from other countries. It is written by NGOs. It het geen onderbou nie. There's no proper basis for this bill. And that's why, Chair, I also told you in some of the previous meetings what the lay of the land is. We have a 2/3 to 70% of the market which is illicit. We have a current act which is not enforced in the least by this very same department. So how on earth do we think a bill, which I've just explained to you, stops just short of a ban, will work if there's no enforcement even of the current act? So a new bill is not the silver bullet. And then lastly, Chair, also on the very first hearing in Rustenburg, I tried to caution about processes being followed, taking Parliament to the people, and already from day one, the non-compliance that there were with the processes. And I linked that to the Mogale judgment. And I'm afraid, Chair, that all those mistakes which the Mogale judgment pointed out has been made and more. The notice periods, the pre-workshops, the advertisements for the pre-workshops, the attendance of those, the attendance, the information in the communities, all those things, Chair. There's a whole list. And we don't want to go into a fight, Chair. The right thing to do is to stop this process, send the bill back to the department to go and do their homework, and let us all work together to put a framework there in accordance with which we can reduce the consumption of tobacco products, allow for new generation products, which is a harm reduction argument, to come into the fray and have proper tobacco control. And at the same time, allow the tobacco industry and all in the value chain to make a living and at the same time address the health issues. It is possible, Chair, but it is not possible with this bill. I wish you luck. I wish you all the strength. And then lastly, Chair, we also know that this bill, unless shortcuts are taken, and I know you're not a man who's going to take shortcuts, this bill will not see its end before this election. It's a Section 76 bill. It's got to go through both houses of Parliament. After the provincial hearings, there are more than 70,000 written submissions, which the committee will have to go through one by one. There are oral hearings to be held in Parliament of many, many people who couldn't get the opportunity at the public hearings. And then after that, it's got to go through the whole NCOP process. So, Chair, there's hope for tobacco control in this country, but not with this bill. And that is the offer that I would like to make to you and also try and give you guidance on this. I thank you very much.
Can I speak?
Thank you very much to all of you. I'm going to repeat the process. I will take hands on the left. Anyone on the left, on my left, take a chair. Lady, yes, please take a chair. Anyone on my left? 3, 4 at the back, 5. So the guy at the back whose hand was up, second last, yes. Lady in the white top, yes. Any more on my left? Far left? Yeah, now you can raise your hand, now you're on my left. That was in the center. You can come forward. Anybody on my left? How many chairs do I have vacant? 3. Now you may come. Anybody on my right? And then the last one there. I said local people first. Anybody on my right? Right at the back. Was your hand up right at the back? Yes. Thank you. We'll stop there now. There are many chairs still open on my left-hand side here, those who are cramped into the back. You can come forward if you want to. All right, let's proceed in that order. Don't forget to introduce yourself, and number 2, don't forget to state whether you support or not support the bill. Moenie vergeet om jou naam aan te dui nie, om te sê of jy die konsepwetgewing ondersteun of nie. Dankie.
Morning, everyone. I am Dr. Jani Fouché. I'm a specialist family physician at Ceres District Hospital. I support the bill. We as staff suffer at the district hospital with multiple admissions that are tobacco associated, from children with chronic respiratory tract infections, adolescents and young individuals that die at the age of 30 and 40 due to chronic lung disease, and adults where smoking is a risk factor for all cancers, for all cardiovascular disease, and a risk factor to the poor control of chronic illnesses. We, as staff members, have other staff members that smoke outside the hospital, and especially our theatre complex, where the smell of smoke often enters the theatre where we're preparing for invasive procedures. Also, our respiratory rooms are flooded with smoking patients that require oxygen. I would like to see a restriction on smoking products. I would actually like to see these patients or people outside our hospital premises. I do support the bill because I know it will reduce the smoking in our community. I do believe that it is your decision to smoke, but I don't want to see you and I don't want to smell you. Thank you.
Short, ja. My naam is Lia Hartnek. Ek is 'n councillor van hierdie einste Witzenberg munisipaliteit. Ek is hier om vir u te sê ek ondersteun die bil. Ek was 'n roker gewees en het in 1992 het ek opgehou rook. Ek kon nie glo dat ek soveel beter gevoel het nadat ek opgehou het nie as wat ek gevoel het toe ek wel gerook het. Die rook het my gesondheid aangetas. Ek kon nie ver in te stap nie, dan weet ek is nou moeg. En ek het meer as 1 keer 'n jaar het ek verkoue gekry, soms erge griep gekry. En op 'n stadium in my lewe het rook vir my onbekostigbaar geraak. Ek moes kies, gaan ek 'n brood koop of gaan ek sigarette koop? En my keuse was, ek gaan liewer vir my kinders brood koop as wat ek sigarette gaan koop. Daarom ondersteun ek die bil. Ek was in die mediese veld werksaam. Ek moes kinders in die skool sê, hulle moenie rook nie, maar ek rook daarom pouse in die teekamer. So daarom voel ek gevoel, ek moes 'n voorbeeld wees vir daardie kinders, wat ek net nou gaan sê, julle mag nie rook nie, want dit is nie goed vir jou gesondheid nie. Ek sê weer, en ek herhaal weer, ek ondersteun die bil.
Good morning, Chair. I'm a councillor from Witzenberg, and I just want to say that I do support the bill. My name is Lia Hartnek. I personally was a smoker who stopped smoking in 1992, and I couldn't believe how much better I felt after I stopped smoking, how my health improved. Beforehand, I would go walking, and I would quickly get tired, and I developed a lot of illnesses like colds. And at a point, I also had to decide about money. Am I going to spend money to buy cigarettes? Am I going to spend it to buy bread for my children? And I made a conscious choice to rather buy bread for my children. I used to work in the medical field, and I told children not to smoke, but then during lunch breaks, I would go and I would have a smoke. So I decided that I want to be an example for them and to stop smoking. So in conclusion, I do support the bill. Thank you.
Right up. Molweni, my name is Yanga Ngosha. I'm from Milnerton, Cape Town. I do support the bill. In supporting the bill, I'm not sure how it will be monitored in townships, because we've got young kids, especially girls, they like to smoke that bottle with water and pipes. They mix that thing with a lot of things. They put water, they will put alcohol inside, they will put the flavor, mix it with ganja. That's what you will find in townships. And then we've got spaza shops that sells illicit cigarettes. So I don't know how the government will monitor that when they pass the bill into an act. But I do support the bill, but I want the government to make sure such things are not happening. Thank you.
Sanbonan, igama lami nguNondumiso Ncamu, and I'm from the National Council Against Smoking. I support the bill. I share the gentleman that just left to say that when the bill is passed, because that's what we hope for, that obviously the government has work that is cut out for them to make sure that there's measures in place and there's monitoring in place. Because all the time when there's changes and new things need to be done, there's always a room for growth, for flaws, and that and the next. So just to summarize the bill as I see it as rules. And these rules are not there to restrict, but to give guidelines and to protect the next course, or even the course from itself. I believe the call for the amendment of this bill is just pure consideration. It's respecting coexistence. It's protecting non-initiates of smoking. It's giving room for sound education and awareness, and to seize the exposure and cut impulse decisions that are made from a place of naivety. I stand here today to just urge each and every person sitting on the chair present today to go and do a little research about tobacco products. All of them, and I mean vapes as well. And I want you, after the research, to ask yourself if vapes are really an aid for smoking cessation. Can they really help people quit? And if you find a person that has smoked cigarettes before and is now smoking a vape, how is the transition? In their physical stance, in their physiological stance, in everything that they are, how is the transition? How is it making them feel? Is it stronger than the cigarette? Is the intensity different? I want us to go back to a place of truth and not from a place of business and a place of misleading people and misconceptions and miscommunications. Because I know that at the end of all the money that you can acquire and the material that you can buy, the only treasure we have as mortals in this earth is our health. We cannot have any money to buy that. Thank you.
Ndibulisa ku Mr. Chair firstly, ndizawuthetha isiXhosa. Ndingunoncedo Qalaqa, ndingumhlali eNduli eWitzenberg. Ndiyisupport ibill ngezizathu zokuba singabantu abamnyama thina, and singabantu abamnyama singabantu bamasiko. Some of the tobacco enithi we are using as traditional, izinto esizenzayo traditionally zinida some of the tobaccos. So asikwazi ukuhlala ngaphandle kwe-tobacco because such as isnafe, when sinentloko, and intloko ayifani nentloko mhlawumbe ubheke kugqirha kuthiwe uyagula unentloko ethile. Kunentloko that needs abantu traditionally that abazawuthatha isnafe baphahle bakulungise nge-tobacco isnafe. And number two, emasikweni wethu sikwa nezinye zezi tobacco esizisebenzisa ukunqanda ubuthakathi because singabantu abamnyama. So thina ke ngoku mna I'm against of i-bill because asizokwazi ukuhlala ngaphandle kwe-tobacco because thina siyisebenzisa for izinto ezibalulekileyo. Hayi not sonke siyayimisuse. Enkosi.